My name is Dr. Rodriguez. I am a weight loss doctor in weightrx.org. Did you know that semaglutide, a GLP-1, glucagon-like peptide 1 receptor agonist, has been increasingly recognized for its effectiveness in weight loss and blood glucose regulation? One of the critical ways semaglutide supports weight management is by reducing postprandial, after-meal, blood glucose levels. Understanding how semaglutide achieves this can help clarify its benefits for individuals with obesity, diabetes, or both, as well as for healthcare providers managing these conditions. Semaglutide works by mimicking the effects of the natural hormone GLP-1, which is released by the intestine in response to food intake. One of GLP-1 and #039's primary roles is to stimulate insulin release from the pancreas, a process essential for reducing blood glucose levels after eating. When semaglutide binds to GLP-1 receptors, it triggers a similar effect, leading to an increase in insulin secretion in response to elevated blood glucose levels. This insulin surge helps to absorb glucose from the bloodstream into tissues, reducing post-meal blood sugar. Semaglutide also inhibits the release of glucagon, a hormone that promotes the conversion of glycogen, stored glucose, into glucose. After meals, when blood glucose levels are already high, reducing glucagon helps to prevent an unnecessary rise in glucose levels. By lowering glucagon production, semaglutide further minimizes postprandial blood glucose spikes. Another way semaglutide reduces post-meal glucose is by slowing gastric emptying, meaning it delays the time it takes for food to move from the stomach to the small intestine. This slowing effect is particularly beneficial for blood sugar control, as it moderates the rate at which glucose enters the bloodstream. With slower gastric emptying, blood glucose rises more gradually and peaks at a lower level than it would without semaglutide and #039's intervention. GLP-1 receptor agonists like semaglutide also help reduce appetite, leading to lower calorie intake over time. By curbing appetite, individuals may eat less, thereby reducing the amount of glucose absorbed into the bloodstream. This reduction in calorie and carbohydrate intake can lessen the load on insulin and glucagon responses, supporting long-term blood glucose stability. Frequent spikes in blood glucose can lead to increased fat storage and weight gain. By reducing postprandial glucose levels, semaglutide helps limit this cycle, allowing the body to use available glucose more effectively rather than storing it as fat. Over time, this process can contribute to gradual and sustainable weight loss, which further aids in improving insulin sensitivity and overall metabolic health. When blood glucose levels are consistently high after meals, the pancreas is forced to produce more insulin to compensate, eventually leading to insulin resistance, where cells become less responsive to insulin. By reducing postprandial glucose levels, semaglutide eases the demand on the pancreas, which can help delay or prevent the onset of insulin resistance, a key factor in the development of type 2 diabetes. High postprandial blood glucose is associated with an increased risk of cardiovascular disease. Semaglutide's ability to keep blood glucose levels lower after meals reduces the strain on blood vessels and can lower inflammation, factors contributing to heart disease. In clinical studies, GLP-1 receptor agonists have been shown to reduce the risk of major cardiovascular events, making semaglutide an effective medication for weight management with added cardiovascular benefits. By slowing gastric emptying and reducing hunger, semaglutide helps people feel fuller for longer, allowing for better control over meal sizes and timing. This appetite control contributes to reduced caloric intake and helps stabilize blood sugar after meals by reducing the frequency of eating. The result is a more even blood glucose profile throughout the day, especially after meals, which is essential for people with diabetes or insulin resistance aiming for better glycemic control. Through a multifaceted approach that includes enhanced insulin response, reduced glucagon secretion, slower gastric emptying, and reduced appetite, semaglutide helps manage postprandial blood glucose levels effectively.
For more information on this topic, please subscribe to our channel or text our clinic number. Brought to you by weightrx.org.